What is the cost of Medicare Part D prescription drug coverage? Click here to learn more, and you may want to save it in your favorites if you don't have time to watch it right now. This is a long form video. Let's talk about this. The cost is really going to depend on you. What medications do you take? How often do you take them? What pharmacy do you pick them up at? Now, every year during the Medicare annual election period, you have the opportunity to change plans for the next calendar year. So it'd be a really smart move to look at your current plan and make sure it's still going to be cost effective for the next year. The plans change. You may have changed during the year. Maybe you've added medications. So we're going to talk about that. How do you figure this out? What kind of resources can you turn to? Let's do this. Now, if it's something you're going to do on your own, your best resource is to go to Medicare.gov. And then the first thing you're going to see when you open up that website is the option to find health and drug plans. So what happens is that all you got to do is follow the prompts. It's very easy. They're going to ask for your zip code. They're going to ask you to input your medications, your preferred pharmacy. And then what happens is it generates a list. And the list is going to be listed from the least expensive, the most cost-effective plan, down to the most expensive plans. Let me show you an example. So I was using Medicare.gov. I loaded in some random medications just for example's sake, and this plan came up as number 3 in the most cost effective. So you look and it shows you what the monthly premium is going to be, and then most importantly, it shows you right here what is going to be the total for the year, the estimated drug cost plus the premium. So when they're listing all these different plan options based on your zip code, again, it is going to show you by the most cost-effective plan down to the most expensive plan. Now, you could choose your plan based on what is the most cost-effective, and typically that's what I end up recommending. But a lot of people want to have more of an understanding of how these plans work. So I made this form behind me on my computer. I'm holding it in my lap as well, so I'm going to be looking down at it as I talk a little bit. But let's talk about the 4 phases as well as the plan premium. So the first component is going to be the monthly plan premium. And you may see really low premiums and you may see really high premiums in your zip code. But you're not choosing a plan based on the premium alone. As I mentioned, it's one piece of the puzzle. You may have a really low premium plan, but your drugs cost $2,000. And then you may have a really high premium plan, and maybe in addition to the premium, you're only paying an extra $200. So while you may have felt enticed by the $0 or the low premium, remember, it's so much more to look at than just that. The first phase I want to talk about is the deductible. It is the time period where you have to pay a certain amount of money out of pocket before the plan is going to help you. In 2024, the highest the deductible could be is $545. Typically, the plans with the higher premium have lower deductibles, and the plans with the lower premiums have higher deductibles. So in explaining this to you, lots of times people are like, well, I don't want this high deductible, but the plans with high deductibles still may be the best plan for you if in the big picture of everything, it's the most cost-effective plan. Now, one thing that can be very confusing is you're thinking, well, I have to pay all this money up front, so why are they covering some of my drugs right off the bat? Sometimes tier 1 and tier 2 drugs don't go towards the deductible. You have a copay right off the bat and they're covering those drugs. Now, when I'm saying tier 1 and tier 2, remember, the drugs are divided into categories of tiers. And typically tier 1's the most cost-effective plan down to tier 6. And each plan is going to define what tier a drug falls into and what that drug is going to cost. Now, once you've met your deductible, you're going to go into what's called the initial coverage stage. And in that stage, you're going to pay a fixed amount, a coinsurance or a copay for the medication. And again, if you look at this above me, each plan is going to define what the different tiers are for the medications. So let's say you're in that initial coverage stage and you have a tier 2 drug, and maybe they've defined it as a $2 copay, and you're going to pay that $2 copay. The plan also is going to be paying its share. And so when together between what you've spent and your deductible and what the plan's spending, if it reaches $5,030, then you're going to be passing from that phase down to the next phase. Now that number may sound daunting, but remember, it's not all money you've spent. It's a combination of you and the plan. So once you've hit that threshold of $5,030, you go into the coverage gap, which you also would have known as, used to be called the donut hole. And during this period of time, you pay no more than 25% of the generic and brand's cost. And then the companies, the manufacturers, pay the remaining, or actually the remaining 70%, but you get credit for 95% of the drug costs. So in this phase, you're paying your portion, the manufacturer's covering their portion, but 95% goes towards that 8,000 number that you have to go to get out of the coverage gap. So again, that number sounds daunting, but what is it made up of? I'm just going to read this. It's made up of your deductible, what you pay in the initial coverage, and then what you are paying, the 25% plus the 70% paid by the manufacturer to get to this number, 8,000. So the way that the rules are written right now, you're not going to spend more than about between $3,200 and $3,300 to end up in catastrophic coverage. Now, once you get into catastrophic coverage, you don't pay anything else. It used to be that you paid 5%, and that coinsurance kept going. There was no cap to it. But with recent legislation, they've capped it that with this out-of-pocket around $3,200, $3,300, and you're not going to spend more beyond that plus your premium. So bottom line is that these are some of the nuts and bolts, and I know this is confusing. It can be confusing for me to explain it. So what's most important, what I want you to walk away understanding with this video, is that when you get this data back and you put in your drugs and you know what the premiums are, look at the total out-of-pocket for the year. Now, sometimes if you go into like a higher deductible plan, then maybe you get hit right away with higher costs, but then maybe the costs level out. Sometimes if you're in a plan with no deductible, you avoid that initial really high cost, but maybe it stays steady, more expensive for the year. So you may be looking at one of those plans to spread your costs because maybe it's too expensive to get hit with the deductible from the get-go for you. So there is some strategy in that when you're thinking about it, but bottom line is you want to have that most cost-effective plan. And it's so important. Not enough people take the advantage of reviewing it. And it could be the difference of thousands of dollars if you end up in the wrong plan. And then this is a tip I always say to everybody. Make sure you hold on to the drug list, the formulary that is created by your drug company. Because what it is it lists all the medications. It tells you what tiers the medications fall in. And the lower the tier, the less it's going to cost you. So if, let's say you had to add a blood pressure med and there was an option of a tier 1 drug and a tier 3 drug, your doctor can look at the list and choose the more cost-effective plan. So lots to take in here, but remember, most importantly, choose that cost-effective plan.